So we have about 40 different sites that are spread out throughout southeastern Pennsylvania and southern New Jersey. There are a variety of different groups that deliver primary care in different settings. Internal medicine I think of as primary care for the adult. Pediatrics I think of as primary care for the child. And family medicine really spans the entire lifespan from birth to death. But once you get beyond those age barriers, really the basic tenets are the same. Each of our patients, at their choosing, chooses an individual physician or nurse practitioner that's their primary care provider. And our goal is to have those be long-term relationships that span many, many years and really give the ability for the patient and their primary care provider to bond together with the goal of ultimately giving them A, a good experience, and B, great outcomes. What we're seeing today is the importance of two other areas that we need to take care of. One of the things that's happened is to recognize that is third-party payers, Medicare, all have preventive health benefits now within their covered services. And so more and more of our patients are coming in not to discuss acute problems, not to discuss their chronic diseases, but really focus on basic prevention. Vaccines, cancer screening, basic screening for cardiovascular disease, basic screening for diabetes, etc. One of the major barriers to getting health care is really access. And when you think about access, you need to think about getting the patient to the right provider in a timely fashion and in a convenient way. So increasingly we've recognized the importance of making available to our patients extended hours. That's evening hours, weekend hours. And so more and more of our practices, we've created a process inside the practice to offer walk-in hours, where we can tell our patients that if you walk in, we'll get you seen. And we also have a feature where for a number of our physicians now, you can actually book your appointments directly online by just clicking a button right next to the picture of your provider. And so, it's just another way of reaching out to patients, understanding that if we're going to be effective, we need to really access multiple different channels to communicate with our patients. My name's Ron Barg. I am an internist and a geriatrician, and I'm also the executive director of CCA, which is the community-based practice network for the University of Pennsylvania Health System.